Welcome to Innovators, a series where we sit down with thought leaders from across the industry to discuss some of the most pressing topics in healthcare. My name is Justine Gincola. I'm on the communications team here at Inovalon, and joining me today is Dr. Kathryn Eshelman, also with Inovalon. Thank you for being here today, Kate.
Thank you for having me, Justine.
You know, one of the main topics that we're really hearing about in healthcare today is AI. So what are you most excited about as AI relates to healthcare?
That's a great question. When we think about AI and what AI has done in the industry across not just healthcare, but across the entire world, especially in the past year, the breakthroughs that have been made, it's really exciting to think about the AI lens in healthcare. And a lot of exciting things are happening around AI in healthcare. Healthcare is an industry where there's still a lot of non-standardized data out there. I'm a physician. When I write a note, document what I saw with the patient, what I noted, what I discussed, that's a very different style than another physician may do. And so AI is a great tool to take a lot of data, synthesize that data, figure out what's important, what's salient, discard what is less important, make that data more standard, and think about what questions should we be asking of this data? So there's a lot of possibilities as far as where AI can go in the healthcare space, because there is so much, as we might say, free text in the healthcare world, where there's a lot of documentation going on that is unique to how I document as a physician. And it's a lot of words, and AI can read through all that different language and come to really solid conclusions under the proper coaching and direction, of course.
Okay, so now how would you say that AI kind of plays in with Inovalon? Where do we fit into AI within healthcare?
Sure. AI is affecting every aspect of Inovalon. At Inovalon, we have software that is used by providers, used by health plans, used by pharmacies, used by life sciences, and it's affecting every part of our business. Specifically around what health plans need for AI, there's a lot of exciting work going on. Like I said before, a lot of when things are documented in healthcare, it's in a very non-standardized way. And if you were going to review a physician's chart, it might take a long time to do that. It might take several minutes to hours to review that chart. You know, what did Dr. Eshelman document? And what did she really mean when she said the patient might have a condition? Does that mean they have it? Lots of kind of ambiguities in the way that physicians and healthcare workers in general document. So you think about that and how health plans need to use these medical records. They need to review them and glean certain pieces of information around whether or not quality standards are being met, the extent of the conditions that are being managed and how well they're being managed by the physicians. So there's a lot of opportunity around how we can apply AI to just medical records, and that's just one instance of where it can be applied. We can use AI and are using AI in our analytics, so trying to figure out what conditions a member might have. AI is a perfect tool when you think about as new data is coming in and you have a model created that is constantly learning and updating itself and getting better in an automated fashion to really find and identify patients who might have a more serious condition than the patient or the physician realize. So there's a lot of opportunities for AI across all of Inovalon. I focused in on the health plans, but there's lots of different examples.
That's wonderful, and being a part of something that is so big is certainly exciting. Another topic big in healthcare right now is health equity. So bringing that back to AI, how is AI impacting health equity?
Yeah, and I'm so glad that there's been such a push on health equity from the government, from the health plans, from all the leaders in our industry to really identify those, what we used to call barriers to care. I practiced for many years with a lot of patients who, just having gas money to get to a doctor's appointment was a barrier. And a lot of those things don't make their way in a discrete, codified way back to the health plan. So again, back to that instance where I might in my chart document that the patient can't afford, gas money or has transportation issues. But that free text language in the chart, sometimes it would go nowhere. And what we can do with AI is we can actually have AI reading those charts and saying, This patient has a transportation barrier. This is the actual code that signifies there's a transportation barrier. Get that back to the health plan, and then the health plan is now empowered to reach back to the patient and say, is there a way we could help you get to that appointment? And so this is what's really exciting. A lot of health plans really have the best intentions. They want to help patients. They want to identify the barriers. And sometimes getting to those barriers, just getting to that information is difficult and lacking for a lot of health plans. A lot of health plans don't have a full picture of all of the social determinants of health on all of their patients. And so AI has a great role to play there, and I'm really excited about what AI can do to really bridge that gap and knock down those barriers to care.
Absolutely. And seeing that AI is positively impacting outcomes, which Kate, as you know, is so important to us here at Inovalon, is really great to see. Before we wrap up today, Kate, any final words for us?
Sure. When it comes to AI in healthcare, the stakes could not be higher. You have people's lives in your hands. You have to make sure that you get this right. We never are developing any AI solutions without human supervision, if you will. It's not okay to just build a model and then walk away from it. It needs constant supervision. We must make sure that the model is learning correctly because it is always learning. So really important, everyone will say this about AI, is that it really needs to be closely monitored by the humans. And with that being said, knowing that we are keeping a close eye and monitoring everything we do, I'm really excited about how AI is really going to revolutionize healthcare, make things a lot more seamless. It can really help the patient-physician interaction. It really can help the health plan get what they need to perform at the highest level. So I'm really excited about AI and what it can do, with that very important caveat that it will always need some human supervision.
Yes, absolutely. Well, Kate, it has been wonderful talking to you today. Thank you so much for joining us. For those of you watching, thank you so much for tuning in, and be sure to check out our next INOvators podcast. Thank you so much. Thanks, Kate.
Thanks, Justine.